right. Next, let's queer up health. Ominous LGBTQ plus health warning as a summer wave of COVID-19 has arrived in the U.S. The LGBTQ plus community and healthcare professionals have disturbing news about COVID. New variants of COVID-19 are driving what is quickly becoming an annual summer surge in cases across the U.S. Infections are probably growing in 38 states, according to the CDC. However, individual cases are no longer counted since the end of the public health emergency more than a year ago. Wastewater tests aren't showing a significant increase in the virus. However, hospitalizations and deaths are on the rise, especially in the West and South. The surge also started weeks earlier than last year as summer travel and for the LGBTQ plus community, pride trips returned to the pre-pandemic levels for the first time. New vaccines are expected in the fall to target the strains that are currently causing the most infections. Well, the interesting thing with, there's been a lot of discussion lately, and a lot of it is about vaccine hesitation, and that is people don't want to be vaccinated. They're like, oh, I'll get the flu shot, but I don't want a COVID shot. Or I want the COVID shot, but I won't get a flu shot. And I think it's just important to understand why the hesitancy is there, and it is education. We had a lot of medical mistrust with COVID vaccines when it came out. Not one shot, now 2 shots, now 5 shots. I mean, it continues, but as that strain develops, you think about the flu, you think about all the strains of the flus that they have out there, and now they have to pick, okay, what's going to be the strain that we hope will be the one the shots will curtail this season. So it's very important just to keep that education, understanding the hesitancy, especially people our older generation, because if they're well, I'm right behind you, but I mean, even like with RSV and other things like that are out there, when you're dealing with anything that's going to be dealing with respiratory issues and an aging population, they need to do everything they can to protect themselves. And while yes, it may not prevent them from getting COVID, it may prevent them from being in the hospital, and that's a big gain.
Right, a milder case,
right.
As opposed to something life-threatening. So, so there's still a chance that COVID-19 could do away with the DeSantis and Trump families? I mean, is that still, because they're not vaxxed.
Well, and the CDC updated the recommendations, and this is really just to bring awareness to our providers, our medical providers, and the public about, if you are in that, I think 65 to 70 or 75 age range. Not there yet. Not there yet. Right.
Full year, 360.
To think about what you're doing to protect your respiratory issues, and especially anybody who's immune compromised or anything. If you're people dealing with cancer. I can't help it. You're on my left. I keep looking that way. I'll look over here. How's it going? But I think the changes are meant basically just to bring awareness to the community and to our providers to make the recommendations to all their patients.
So all that is great, but I'm still stuck on the fact that they measure our wastewater to determine what is out there. What else are they testing? I know that, but
do you want to know?
A sample? No, I don't.
Okay.
But that's where we're going for samples, but iron and stuff in our food is still okay, or there's got to be other stuff. I mean, what else are they going after?
Right.
That's crazy. It's in our wastewater.
We'll hear those study reports next year.
Is it from small towns in Louisiana? Is it from New York City? Where are they testing this water?
Right.
It's a big country. Different results.
But COVID really is still going around. I just had a friend on the phone in Boston was telling me, oh, I can't work this week because I'm sick with COVID. And I'm like, my goodness. Now, I, of course, looking at this, the first thing I remember was I'm so glad a few weeks before Pride every year now is when I get my booster shot. Because I know I'm I'm going to be a hot mess and hang out with too many people.
Being so proactive.
The first Pride I went back to post-COVID. My boyfriend and I, we were so sick for a week afterwards. We didn't get tested for COVID, but
what did you
it was most likely COVID.
No, we probably don't know what you did.
So.